Hello, welcome to Your Health in Your Hands. I'm Dr. David Ajibade, and I'm here with a very important guest. You know how we talk about dementia and how we got to look at it from every possible conceivable angle. That dementia is not just about memory loss, but it's also about so many other things like balance, your processing ability, your ability to recognize patterns, shapes, your senses, your five physical senses, and just perception in general. So it's dementia, and I got to say, it's to be regretted that we've just fixated on that one thing, memory. And we've also, in terms of the medical profession, we're fixated on one cause of the disease, which is, of course, the amyloid plaques. Not to say that they're not a cause, but there are several other things that combine and work together with that singular cause to create the disease known as dementia. So it's always a big pleasure and a privilege when I see someone who is actually addressing a particular aspect of dementia that is extremely important. And in this case, this has a lot to do with the education of the caregivers and the loved ones of people with dementia. And I think that's going to be an exceedingly important skill and topic as we go along, because as you know, the numbers are just exploding, not just in the US, but around the world. So without any further ado, I'm just going to welcome our guest today, Pam Brandon. How are you?
I'm great. How are you, David?
I'm doing good. Thank you so much for making the time. I know this was super impromptu, but the best things are impromptu, right?
Absolutely.
So we're going to get right into it. So first of all, just give us a quick, I know we did this offline, but give us a quick, how did you get to where you are and what you're doing, the value you're bringing to the world of dementia?
Yeah. So really, like so many people who have come to this space, it was personal experience. My parents I became a caregiver at 35 with my dad having a diagnosis of Alzheimer's disease, and later my mom with Parkinson's disease. And so this was more than 25 years ago. And, young mom and or mother of two young children and busy husband and becoming walking into the world of caregiving and knowing absolutely nothing about it. About either of these diseases, and about really back then, really even self-identifying as a caregiver was difficult at best. So it was probably 5 years before I even knew that my role was a caregiver. But all that said, it changed the path of my life during those long 15 years. And I decided that I needed to be in this space, that was where I was, my passion was leading and where I could help others. So I went on to develop family caregiver education programs, working throughout North Texas, and becoming really aware of the huge needs, not just family caregivers, but professionals as well. People just did not know about how to care for someone living with cognitive decline.
What was, if I may just jump in, what was some of the most striking things that stood out to you to let you know that this was a big need? I mean, were there some mistakes, some egregious mistakes, for example, that you were seeing people make, or were there things that you saw that they should have been doing, but they were not doing?
Going back, I can remember my most stressful, not being prepared for the stress, the emotional, spiritual tug, the physical stress, all of that. Caregivers need help with that. They need help along the way. But from the standpoint of the healthcare, my communications with the doctors and the healthcare professionals, both, when I'd go to office visits with my parents or in the hospital, we had many hospital visits. I was looking for resources from them, and they just didn't have it. Just plain and simple. I mean, I could talk about that for an hour, but I was lost. And so it was up to me to do the digging. And I am the type of person to do that, but a lot of people don't know how to do that. Now, this
Right.
was also before we had the internet, but I think right now the internet can also overwhelm caregivers. You can
Exactly.
go from not enough to having way too much information, and then you shut down. What
Right.
I found was that you have to help caregivers with the most urgent issues they have and help them with that, and then go on to the next urgent issue. And slowly, then you become an empowered caregiver and you feel better about your knowledge and your ability to apply that knowledge. And, as time went on, I felt more confident. But if I had had somebody try to give me everything all at once, I would have just shut down.
That's an interesting point. So let me just jump in again. So when you were looking for information, can you give us an example of the specific kinds of information you were needing at that time? And then fast forward to now, what is the most common thing that you feel caregivers and loved ones are looking for when they first maybe come in contact with you or when you reach out to them?
Yeah, I think it comes down to what I continually felt myself, and that was, man, I don't understand how Dad is feeling right now. I don't understand what he's going through, right?
Mm.
They were struggling with living at home, and there were lots of complicated behaviors that he was starting to exhibit. And at the time, it was just like, let's, surely if we step in and, tell him what he's supposed to be doing right now, it's going to help. Well, it wasn't. And what we didn't realize was we didn't understand what was going on in his brain. And
Mm-hmm.
same with Parkinson's. You have no idea the complexities of emotions somebody with Parkinson's is living with, much
Mm-hmm.
less the complexities of the disease itself.
Mm-hmm.
So it was constantly me wanting to work on me being more empathetic and me being more, can we get to the bottom of, how they're feeling so I can start to help them. I never really felt like I got a whole lot of that from healthcare professionals. I think we're making some strides. We have a long way to go.
Which brings me to another point is that what are some of the things that you would, if you were king or queen for a day, what would you mandate that healthcare professionals know and implement in their practice when it comes to dementia? So that's another question coming up. Still want to know what those things you're seeing today, what people are looking for specifically when they have when they're faced with this problem.
Yeah, I think people today, and I'm going to express this from the many, many people who have our program and express to me, is if people could first step into someone's world, their view of just about everything changes. I mean, isn't that true of life?
Right.
If we could step into someone else's shoes, maybe we wouldn't be so judgmental. Maybe we shouldn't, I mean, that is just taking that whole philosophy of, here's this complex issue of dementia that has so many pieces and parts that change daily, hourly, minute by minute. We're asking caregivers to do jobs that are overwhelmingly difficult. We have 16 million caregivers, families in the US alone, hundreds of millions globally, who are struggling with, where do I start? How do I move from where I am now, which is feeling overwhelmed, emotionally drained, physically drained, to moving through this? The families that will continue, the growing numbers that have no resources out there, and they have little chance of getting outside help, right? It's all on them. They need someone to, not only they need a starting point, but then they need someone to have that conversation with, who can listen to them and hear what they're feeling, because what what you go through, the emotions that you go through, and when you go through a program like that where you're going through that experience, you then a caregiver often mirrors those same emotions that someone with dementia is feeling. If a person with dementia is feeling chronically frustrated and anxious and lonely and depressed, and all of the myriad of emotions, oftentimes those emotions will transfer to the caregiver. That certainly was what I experienced. If my mother was feeling that way, suddenly I became, feeling down like she was, because I wanted to help her and I didn't know how.
Yeah, so that is such a huge problem. That's frustration, and I've dealt with brain disorders across the spectrum, the age spectrum, from children with autism and other developmental issues to, of course, people with dementia, and you see that same frustration across the board. What is going on? Why are they acting up or not at all? Or secluded or just sitting in a corner. So that's so important. So let's talk about your program, your unique program that helps people really understand and get into the minds and also, as you put it, in the shoes of the person with dementia. What exactly is it? Is this something we can all access in some way?
Well, I hope so. I hope that more people access it because it's powerful. It's a simulation. It's called Dementia Live, and it takes people through the experience briefly of what it might be like to live with cognitive challenges. And so what we do to alter someone's senses is we give them gloves to alter their tactile sensations. Then we give them eyewear that decreases their peripheral vision, often sometimes associated with dementia or other cognitive issues. So they're only seeing that, you're familiar with the binocular vision or ocular vision, just those little circles they get to look out of, basically. And then the last thing we do to alter their senses is put some headphones on them. And the headphones have what we call confusion sound. So that is meant to simply confuse someone's brain. And so, again, we're preparing that person basically to go through an experience to feel what it might be like to live with dementia. So they go into a room and we give them some simple tasks to do that without all these components on, they would be able to do these tasks easily. Button some buttons, fold some pillowcases, feed the dog, count out of a change purse. We give them 5 tasks. There's many tasks in the room. But what happens, David, is the trained coach gives them these tasks to do. They're hearing this confusion sound. They've got the glasses that are confusing their vision. They're not feeling anything, or they're feeling much less than they could feel. And what happens? They're given these tasks, and they may remember the first one, but what they're really hearing is about every 4 or 5 words of what we're saying.
Really? Really?
So imagine what it would be like for us to have a conversation right now where all you're hearing is every 4 or 5 words of what I say. You'd be lost.
Right.
So our aim with Dementia Live is that participant does not get their task correct. And it's almost 100% when it's done correctly. They're not going to get their tasks. They're going to take their headphones off after 5, 6, 7 minutes and say, "Oh, wow. I thought that I heard you. I didn't." After the first task that, they end up doing only halfway. Maybe we asked them to button a shirt and instead they put the shirt on. Maybe It's those kinds of things that we see as they do the task, but they don't do it all the way. They forget the task, but then we're observing them. And what's even more amazing is what we're looking for is behaviors typical of someone who is living with dementia. So in Dementia Live, we will generally put a small group through the experience, 4 people or so, go into a room. They're all given different tasks to do. And so what are we looking for? We're looking for someone following somebody around. Is that true with someone with dementia? Very, very common. We're looking for somebody who just sits down in the chair and gives up. Now, we're looking for these and seeing these behaviors on a consistent basis. So, we're looking for somebody who maybe verbalizes their frustrations. They're getting mad, or they seek out someone in particular or something in particular, and they just work on that. One of the things we put in the experience room is a puzzle. And oftentimes, if people have forgotten the task we've given them, they've gotten confused on what it is, they'll just sit and try to put this puzzle together, not successfully most of the time, but they'll zone in on one thing and they'll just kind of get in their own little world and do that one thing. So after we've observed what they've done and we make notes on a chart, then when we tell them that time is up and we take those headphones off, the first thing we ask them is, how do you feel? And we do that purposely to get those raw emotions. How do you feel? Because that's what it all comes down to, is feelings, right? We have to get those feelings out to be able to start to get to that next step of learning. So we have, I don't know if you can see this, but we have what's called an emoji sheet that we created.
Oh, okay.
And it helps someone to prompt them. We give them this emoji sheet and we say, look at some of these. Are some of these things the way you felt while you were in the experience? Were you angry, bored? Did you feel determined? Did you feel inadequate, confused, foolish, irritated? All those raw emotions, lonely, tense. Did you feel worthless? Those are just a few of the emoji prompts we give them, because those are the things then that we can begin an impactful conversation with. So the coach is then trained to start to say, okay, let's talk about these feelings and let's talk about the behaviors that we observed while you were in that room. And you begin to merge those two. And it's that aha moment that begins to come out. Well, how can this help somebody? It can help a caregiver. I mean, emotionally, many people, they can break down in that during that time, you can imagine.
Right.
But what we can get through then is sometimes that barrier. Oh, I see that mom does not have the ability to do that. Now I can see where when I, tell her 5 times what she had for breakfast and she continues to ask me, that she really can't remember that. And that I can use a different means of communication that will not embarrass her, that will not make either of us angry, that will move this to a better both of us to a better place. So those key simple communication skills that they can learn, those are simple and powerful. So, it doesn't have to be complex. We can use simple things.
Absolutely. So that's fantastic. So it helps with empathy and, of course, sympathy and understanding.
Right.
But compassion, right? So that feeling, and so that ease, it takes the sting off the stress and those frustrated, aggravating feelings. But what else does that do, in your opinion, this exercise?
So our goal with Dementia Live is that every person that goes through this is going to leave not only with that deeper empathy and understanding, but they're going to leave with a tool. So we've created 20 plus what we call empowerment tools that go along with this training. And that is that if, for instance, that caregiver is most struggling with, say, communications, we have a tool to improve communications, and it's bulleted, simple, the most powerful tool, tips we can give them. If that caregiver is dealing with caregiver burnout, we have a tool. Here's how to deal with, here are some steps to move through caregiver burnout. We encourage our coaches who are trained in this, have your local resources from your community. Where can they go to a faith community or community center to get into a support group? Have those resources there. We have a myriad of resources that are for professionals for, specific areas they work in, dining, activities, etc., that are directed to that. But then, because I'm a family caregiver, that, my real passion has always been with this, to give the family caregiver resources that they need so that those tools are there. And so our providers who are trained on this program can use this as a very powerful outreach tool to reach caregivers. I say this all the time, David, but everyone in this space needs to have the tools to help family caregivers. There are not enough of us to reach the needs today of family caregivers, even if all of us were doing it. And the number of caregivers that we are going to have within the next 10 years, it is frightening to think that more of us are not doing this. It is the World Health Organization calls it a public health priority. In terms of our healthcare system, this, it is a public health crisis. It is costing our healthcare system enormous amounts of money when a person with dementia goes into their ER, when there are no coordinated services, when they leave the hospital, when there is not information given to the families, when they are in a hospital, when they are in a doctor's office. All of those steps along the way in the healthcare system need to be buttoned up, and we need to do that quickly.
Absolutely. So that brings us to that question I asked earlier. What would be, if you were queen for a day, Pam, what would you mandate should be in terms of the healthcare professionals trainings? I mean, what would you say? This is step by step. This is what the doctor should know about dementia. And really, I think every doctor, even pediatricians, should know about dementia.
Yeah. And that's right. That every resident receive training. We've got some of our providers who are, using this in the resident training now. Not enough. It's not mandated training. We need to make sure that everyone who touches older adults today receives some training. This is part of the dementia friendly community initiatives, is how are we going to get not just the healthcare providers in? I think, David, you need to start with what are the universities? Where is their role in training the future nurses, therapists, doctors? Let's get that training in, quality training in at that point. Do we need refreshers along the way? Absolutely. We need to give doctors training on how to communicate with their patients and how to communicate with their families, how to hand them resources that are not overwhelming, but are specific to their needs, right? So just like I said before, you can over-educate somebody to where it's too much. When you've overeducated an overwhelmed person, it does nothing.
Mhm.
So I think, we're seeing many universities embracing our program because they
Mhm.
see the need to train those nurses and other healthcare professionals, allied health, so that when they enter the job market, they have tools that are going to not just set them apart, it's going to prepare them so that we
Mhm.
don't have them leaving their profession because they're undereducated. And that is what's happening. Education is the key. You've got to give these people the tools they need, or they're going to get frustrated and they're going to leave, and we can't afford that.
Absolutely, absolutely. So that is fantastic that some universities have already adopted. So they've adopted your entire program, or what exactly have they
Yes.
adopted?
Yes, they've
Fantastic.
adopted. We have more than Dementia Live. We have another program called Compassionate Touch and another engagement program. But I'll just talk specifically about Dementia Live. So they'll get trained with the
Mhm.
Dementia Live program, and during the course of their student work, they will go through Dementia Live, and some will now are developing certificates where they are they leave with um, a certificate that they have created that says
Mhm.
they have gone through so many hours of dementia education.
How long is the dementia live? Is it from what you're telling me? It's not like a sequential thing from day one to day 30, for so to speak.
No,
Okay.
no, the experience itself is about 7 minutes,
Uh-huh.
and then the
And that's a
empowerment session
and that's
can
like a
be
diagnostic. It's like the first step, if I remember
the
correctly.
first step.
Like the first step. And that helps you diagnose which direction to start educating them in. So they have different groups or different directions they go, depending on what the feedback was from the live. What do you call that again? That
Uh, it's segmented, so they have the experience portion, which is about 7 minutes, and then the empowerment session. That's our dialogue with the caregiver. That can be
Mhm.
anywhere from a 10 or 15-minute one-on-one small group discussion to a classroom discussion. So, we've got the tools in there for the coach to understand how to implement in a variety of settings. So it's important, that they say a university, they can use that for several types of discussions, group discussions with their students. As you might imagine, they can target it to different settings that student may be in. And okay, let's learn about let's go back to the Dementia Live experience. Now let's apply it to you being in a home care setting, if
Right,
that's what they're doing, or being in a hospital setting.
right.
So it's just, the program is packaged, if you will, to be able to offer it in a variety of settings for a variety of healthcare or aging services providers.
Got it. So when you say students, are we talking about medical students?
Medical, any nursing, we've got a university that used it for pharmacy, have been using it for pharmacy students up in Canada. So think about, we've got one University of Northern Iowa created what's called a dementia simulation house. They had a house available,
Okay.
and they used the Dementia Live program within this dementia simulation house. They now are getting students from all different disciplines to go through, because it's kind of the cool thing, and I want to touch on this, is because how are younger people needing to learn today? Right? The old methods of learning are not working, right? Dementia Live is experiential. There's an element of, I don't want to say fun to it, because it's more serious than being fun, but it's very engaging. How do young people learn? By engaging in something, by being involved with it. So back to University of Northern Iowa, they've got this DEMSIM house, they call it. And so they're not just putting their gerontology students through, now they're putting through, other disciplines, say architecture and others. And guess what? It's opening their eyes to the aging services field. And what they're seeing is students are saying, I might want to have another degree and add gerontology. I might want to get some gerontology as my minor, because I see the huge opportunities ahead and the huge need ahead for maybe me to take my architectural or engineering or whatever degree that I'm in, and I may want to direct it to this world of aging that I had no idea was so huge. So serving many purposes there in, as people in, a 20-year-old may already be affected by dementia. Maybe they have a grandparent or a parent with young onset. And they're certainly coming out of the Dementia Live experience, sharing amazing things that, wow, they have already been touched by dementia.
You are absolutely right about that. I remember when I was being interviewed by the TV, WBAL TV, I think that's the oldest TV station in Baltimore, and both of the ladies who came were, I guess they were in their 20s. In fact, the younger one, she was just a sophomore or a junior. She was a junior in college, and both of them had lost their grandparents to dementia. And I'm like, how can this thing be affecting so many people? And of course, they were both Black, or shall we say, colored, and it is exploding in the African American community. And so, obviously, being African myself, to me I'm particularly concerned about that. Baltimore is ground zero, by the way. I don't know if you know this, but Baltimore is ground zero for dementia as a whole. It's among the top 3, but for Black African Americans, it is number 1.
Really?
And,
Yeah.
So,
we when we talk about underserved and rural populations, we know the need, right? I'm right in the middle of Dallas, Fort Worth, Baltimore, where you think, resources all over. Not so when you talk about underserved communities. And I am really passionate about getting our programs into community-based organizations who are reaching these communities. I want to see us go into countries that are underserved with, they have no dementia plans. Many of the countries around the world have not a dementia plan in place. And their rates are growing faster than the US. So I think it's wonderful that we've got research and money going to finding a cure. We have real problems today that need to be addressed with people that are crumbling, and the underserved communities. They have no resources at all. We need to find a way to do it better.
Well, and that's my focus too, because it seems like the approach now is strictly, we don't know what's causing it except that amyloid plaques mysteriously show up in the brain, and so let's get a drug to get rid of the amyloid plaques. Valid point, but if you're dealing with people, like you said, from underserved communities, African countries, in Nigeria, for instance, the life expectancy is about 53, 54 years of age. Now that is changing. If suddenly it's exploded to 60 years of age, I guarantee you there's going to be a tsunami of people with dementia, because obviously people will be living much longer than that. And like you said, when we are not prepared, we are not prepared for it. And I'm already beginning to get calls from Nigeria and other parts with people whose parents or grandparents are coming down with dementia, and so we're having to deal with it. So I really feel that the approach has to be more comprehensive, more all-embracing, and really let's understand why people. What are the pathways? What are the mechanisms? It's not just enough to say the amyloid plaques suddenly appear. We've got to understand what are the things that lead to dementia. What are the lifestyle habits? What are the dietary problems? What are the mindsets or the psychological stresses? We know that's a factor. But again, even in the Black community in particular, what are the things about Black people? It's not just the environment. It's not just racial issues. Definitely play a part, but it's also it's because in Nigeria we're all Black, so there's no racism in Nigeria. I mean, there's tribalism and there's religiosity and religious conflicts, but no racism. But we still are getting dementia. So what is it? What is it about our biology and genetics, our lifestyles, our diets that is making us so? And that's one of the things that I'm particularly interested in. But what I found out is that once you start digging, you now find out principles that apply across the board to whites as well as Hispanics as well as Blacks, because we're looking for the common denominators, the things that what are the weaknesses that make people more susceptible to dementia. And I think that's what we need to be finding out. And like you said, what we need to be teaching people from a younger age group, high schools, colleges, and so on, so that they start putting those habits in place and getting rid of the bad habits that lead them towards dementia, in my opinion.
Yeah, and access to resources. I mean, they just don't have the access that we have. If you will allow me to share my screen, I would like to show you something that is my latest initiative.
I think I clicked on the button. Can you share now?
I can. Yeah.
Okay. Yeah, I was going to ask you for your website too, just to make sure you give us a website so we can have that as well.
Yeah, you're not seeing that.
I'm seeing your desktop.
Yeah, I'm trying to pull up this. Why is this not? Here we go. You see that?
Yeah.
So
I can see ladies, yeah.
I am involved, actually president of the board of Dementia Friendly Fort Worth, and we have been in existence for about 5 years, done amazing things, really, there's dementia friendly community initiatives popping up all over the US, all over the world. And many of them are struggling with financing their mission, building the public support, yada, yada. Well, what we've done here is, because I've been on the board for 5 years, they have the Dementia Live program. They have been able to get funding because of Dementia Live. So this is my latest kind of brainchild, and I am working here to gain excitement around the community. I also think it's a catalyst to making dementia aware, to creating the dementia awareness, excitement in a community, like what people need to know who work in banks and retail stores and grocery stores and everything else. They need to understand dementia is a thing, right, that we need to be concerned with.
Yeah.
So we're trying to raise money for this, which is the Dementia Live mobile experience, to actually take this training out to the community. So I've had conversations with some different folks, and I've said, this is not the end all be all, but it is a catalyst to get this out to the underserved communities. You have to bring dementia education to them, right?
Yeah.
You have to bring it. If they are going to church every Sunday, bring it to church. If they're going to their doctors, get this to the medical center. There has to be a way to do it, but also I believe this is a more private sponsor, has more options for people to privately sponsor. We can't rely on public funding, right? Or that's becoming stretched.
Yeah. Yeah.
So this is, I'm sharing this with you for you to hear my vision going forward of how we can take this and grow the community's buy-in, private dollars behind the dementia-friendly movement, and doing it through this means, I believe, is going to open up more avenues. We certainly have people who, one of the foundations here said, well, you can fund this in an afternoon. Now, the operating dollars are another story, but I've got, sponsorship levels and whatnot for that. My point is, you've got to stir some excitement. I mean, there's got to be something that will draw people. And if it's a van that does this amazing Dementia Live within the RV, you can actually do the Dementia Live experience in the RV. And if it builds that, kind of like the dementia simulation house, if it builds the movement of what communities need to do, I think what frustrates me and probably you is we see a lot of talk at the federal level and the state level, and the change is going to come at the community level.
Oh, absolutely. What is your experience? Yeah, bottom line, it's got to happen. This is a definite grassroots kind of movement. But what is your experience with churches and other faith communities? I know the dementia experience, live experience, is something else. But do you go give talks to churches or groups?
I used to do that. When I talked about my getting into the space, I mean, it was really, I had started a support group in my own church, which at the time, the church we were attending and very involved with, small church, and the group exploded. I couldn't believe how many caregivers there were. That led me to helping other churches start their support groups, and that led to then my work in facilitating, helping other churches start support groups. And I would go around and facilitate their monthly support group meetings. I loved that work, David. I loved it. I loved being able to talk to caregivers one-on-one through their journey, years of being connected with them and seeing how I really believe in what a support group can do. And when it's well facilitated, the connections they made, just not with me, but with each other, obviously, and the education they could get.
That's so important.
I think faith communities need the guidance. They need guidance. They need the champions within their churches who will step up and say, this is an issue in our church. It's not an old person's issue. It is everybody.
Absolutely.
And I think churches are, some churches slow to make that movement. Are you familiar with the Altar program?
No, what is it?
I need to send that to you. It's a lady, and she is a professor at Emory University, but she's developed this program. It's called Altar program. And I have not talked to her directly. One of our team members recently had a conversation with her. She is working only within the African American community in building dementia education, programming, and support for faith communities.
Oh, that would be good to know her.
She'd be a great connection. I will send that to you.
Yeah, please. But you have not made, it's one of your team members has made connection with her, right? You have not communicated with her directly.
No.
Okay. Yeah,
but that's I've emailed with her. But she's looking at bringing our Dementia Live program in and having her Altar program churches be trained on Dementia Live so that they can train their members and go out to their communities and offer Dementia Live training. She's
That's
very
fantastic.
passionate about
That's
this.
fantastic. Fantastic. Congratulations on that. That's fantastic.
Yeah, I'm excited. The other thing, though, that I see that these RVs can do, is not just Dementia Live training. I mean, that is your resource center. It's your health and wellness. I mean, you're so, focused on this is, how do we teach people healthy habits, and educate people that you do have the responsibility and the ability to determine if you're going to have chronic illness later in life.
Yeah,
right.
for sure.
And that includes dementia. Just because your parents had it doesn't necessarily mean you're going to have it.
Right. Right.
Um,
Absolutely. I would love to see if we could collaborate, really, because I think, the more you talk, the more I can see there are areas of synergy. Especially, so you're more focused on the caregiving side. Obviously, I'm more focused on what it is, what's happening inside the brain, and how things that you do on the outside or do on the inside can lead towards dementia, towards a damaged or compromised brain. And I love to show those steps and how that thing happens, so people can catch themselves if they are on that pathway, and they can catch themselves and say, okay, I need to do this, this, and this to turn the ship around, so to speak. So I think there's some kind of synergy there where we could work together. I got to tell you, because
we have a lot of people who go through Dementia Live and they ask those questions. They, it's like, oh my gosh, and especially if they're caring for a relative, and they're like, start to ask questions of, what do I need to do? What do I need to know about my own life?
Right.
And, again, you and I think, oh, that information is everywhere, living.
No.
It's not.
No. Even, what I found out is this: even if it's out there, it's a totally different matter of bringing it together to be relevant to the person's specific needs, the specific situation in life.
What I said.
A totally different thing. Yeah.
Exactly what I said about caregivers. You don't overwhelm them. You take them where, you have to give them the tools that they need today. They can embrace those tools and then move on to the next thing that they need help with. I had so many needs as a caregiver. I had to compartmentalize what I needed help with. Some days it was, how to communicate with healthcare providers so I didn't go crazy. Some days it was medication management. Some days it was my own emotional well-being. There, it goes on. And it's the same as what you're doing, is people look at their own health today, and I think they just some people can get overwhelmed with it.
So do you address each of those things? Do you have like a
tip sheets?
A video?
You
have cheat sheets.
Tips and technique sheets. Yeah. What we call empowerment tools. Yeah.
And the website is give it to us again. I know you kind of displayed it, but what is it again?
I'm gonna give it to you right now.
No, you got to call it out because someone is listening to it.
Oh, it's educate.com. I'm sorry. It's AGEUCATE.com. So yeah. And it's not educate, but it's educate.
I love it. I love that play on words right there. Love it. So this is what we're talking about is under tools. Is that like a navigation bar that said tools, or how do we find it? Why don't you tell you what? Why don't you open your website and kind of like just give us a brief tour, if that's possible?
This is the homepage. So you go to our solutions. So you've got education and training solutions, and you go to our programs. So these are the different programs that we offer, not just Dementia Live. Compassionate Touch. You would be interested in Compassionate Touch too, being a doctor. Skilled Touch program, Skilled Touch techniques created by a massage therapist and occupational therapist
Mm.
that shows decrease in blood pressure, just all kinds of work that she's done 15 years back on using these simple techniques to reduce agitation, reduce stress, again, the blood pressure, all these wonderful programs. Then we have Reveal Aging, which are 1-hour courses that are all what we call our quality of life suite. So we do not do training on mandatory, those state regulated courses. Reading to Connect is a reading program for people with dementia that is amazing and very unique, very powerful. Flashback is a reminiscence training. And then Ageless Grace is a fun program that is based on neuroplasticity, movement program, fun, very flexible, very engaging. And that Ageless Grace and Reading to Connect, we have partnerships with people. All the rest of the programs we have created ourselves.
Interesting. Interesting. So you must have a huge team back there.
We don't. We have a small but mighty team. We have 10 people.
Wow, 10 people doing all this. That's amazing.
Yeah.
So do you form so when all these other what do you call them, coaches, caregiver coaches, are they people that they're not on staff, obviously, right?
No. So if you want the Dementia Live program, for instance, here is the Dementia Live program. So we go through you can get our white paper, you go through the intro video of a bit of, what it is, dig deeper with that, and then, testimonials and whatnot. And then you go right to what it includes, the training, the 6-hour training, you get the gear pack, the manual, you get access to some courses. And then once they purchase, what they get is they can take the coach training, which is an online total 6 hours. They get 2 hours, and then they have to do self-directed practice with that. And then they come back and they do what we call a wrap up. And I actually lead that training. It's all online at their own pace. And then the model is really the same for all of our programs. So a provider would take this program, and that's, that's the model that we have. We are very well priced. One of the things that when I started this business was, I don't want to be a training provider that only could, a small group of people could afford to buy. This is an affordable program.
That's fantastic. So you have videos of you taking them through this process, or is it
I do. Yeah, if you go on our YouTube channel, you can float around there and see there's many of us on there. But I actually am leading the coach training that we offer on Dementia Live. I don't do the other coach trainings, just Dementia Live.
Okay. And of course, coaches have to have some kind of certificate. They get some kind of certification from you that they've gone through a certain.
Yes.
That's great.
Yeah.
That's great.
So where I really envision, can I stop sharing?
Yeah, sure. I'll just take it back. Thank you for doing that.
So what I really see our growth, I'm most excited about is our opportunity to move into working with managed care organizations, the Humanas, the those organizations that really are having to dig deeper into social determinants of health. They need to show outcomes in their public health initiatives and reaching family caregivers. We worked several years ago with Cigna, their outreach educators. I mean, they they absolutely had the highest outcomes with our program. With
Wow.
dementia.
I think we should discuss the possibilities. I didn't just mean discuss like another discussion and all that, but maybe I think rather than just say I'll just leave it for some other time, I think even if it's just like creating a video again, just kind of like talking about like some of these things now with how the process spreads, how dementia. Let me get my thoughts right now. So of course, obviously you've got the mild, you got the moderate, you got the severe. I'm assuming that you address each of these independently, right?
Yeah,
And,
we not independently, it's a broad sweep. As I said, when people say, well, what do people have exactly this? We don't know. And we're not trying to compartmentalize. What we're trying to do is get that person's wrap their head around where their person they're caring for could be, right? Where they might be at any given time. So it's a broader sweep instead of getting real compartmentalized.
Got it. So one other option is to have like either a live meeting either on Zoom or in person. I could always fly down to Houston if you have something set up where part of what you're offering, including what you talk about and you're passionate about, is also what I'm what I'm talking about and what's going on in the brain and what people need to know and do, not just for their caregivers, but like you said, for themselves and for their kids as well, so that they don't get into that position.
Right.
For instance, I'm just giving you a perfect example now. What I saw that was seriously lacking, especially from a Black person's perspective, is that no one was talking about the importance of vitamin D for brain health. And Black people are particularly deficient in vitamin D. Now we know, and there are now studies that are coming out that vitamin D is crucial to the prevention of dementia. And they basically talk about what vitamin D does for the brain, not just for its function, but also for its protection throughout life. And they show now that things that people who develop that dementia is because vitamin D isn't enough or isn't available to do certain specific things in the brain that have to do with brain function and structure, and that because it's not available, it can lead to dementia. So such things from a Black person's perspective, I mean, this applies to white people as well.
Sure.
But Black people are much, much, much more prone to this deficiency. And I don't see anybody talking about it. This is just one of several things that I point out. But the vitamin D one is the most glaringly obvious, right? It's the most conspicuous. But there are other things too that we as Black people have deficiencies in. I don't know the best word for it, but deficiencies in. And I found out that white people can't go out and talk about this because it's a touchy thing. It's a touchy subject to speak to for a white person to speak to an audience that has Black people in it and say, you're deficient in this, this, and this. That's why you're more prone to have dementia. It's hard to do. I don't think anybody who will have the kahunas to do that. But I do it because obviously they see I'm Black as well and all that. So that's probably one of the things, the advantages that I could, that's been me on board with what could bring to the table for you.
Yeah, absolutely. And, that's something that I have a question with that. I'm very aware of the importance of vitamin D and make sure I get it and whatnot. If somebody is low in vitamin D, and they start it, is it something that the past damage they can't make, if they start on vitamin D, if they find out from you, maybe my loved one is low on vitamin D, I should take them and get it checked. But if I start them on it, can it improve their cognition?
Well, if it's really, really mild, maybe. What I tell people is that vitamin D is important for prevention. Now, once you've gotten once you've developed or been diagnosed with dementia, you're no longer preventing anything. You're trying to fix the damage. Right. So you you're definitely going to need the big guns, much more powerful things. And I do that myself. So I've spent most of my life sourcing for the right solutions to brain problems. Obviously I don't publicize it because obviously that's a big touchy subject. But back home, they call me and I have people all over the place being treated with using our approach, and we use several different things. And the bottom line is that we're trying to get the right nutrients and the right doses that will help nourish, restore, strengthen, repair the damage that's been done in the brain. And many times we are able to move the needle significantly. Yeah. So yes, we're able to do that. But vitamin D is not going to do it. You're going to need vitamin D regardless. I mean, regardless whether you have it or you don't have it, but it's not going to reverse anything. It's not going to. Yeah. There are other things that can reverse. I'm saying it. This is not going to be recorded. You guys will have to take this out because I want to be careful about what I say in public. But yes, we do have patients who've been able to significantly, who are dementia. They are pooing all over the place, and they're doing. I mean, it's really bad. We've seen significant improvement from what we've done. Yeah, I believe it. And those, you're right. I mean, you've got to be able to have the conversations where people can say, yes, I can access this. It's affordable. It's, you know what I mean? They need it in steps. Yeah. So, by the way, so if you do know of people who are willing to try something that is unorthodox, but is safe, like what I talked about, it would be great. Maybe we can have that collaboration as well. Maybe you can send them our way, and we can talk about. And I'm always careful to say this, but commission sharing. I mean, if they do want to go that way, I usually have a way by which I give 10 to 20% of what comes in our way to us. But again, I want to be careful not to make it seem like the profiteer over someone else's misfortune. Right. Well, let's think about what we can do together, and what kind of education we can pool, and how we can help each other with both of our businesses. I would love to be able to see how, I'm just going to say, if we could get into Africa with this training, oh my goodness. I would, it's going to mean translation, but I would love to talk to a university or some entity that can see what this could do. Okay. Yeah. Let's help each other. Let's see how it works. But yeah, I think that there's some synergy here, because I think the conversations often lead to health, and we haven't addressed that. Yeah, for sure. Okay, well, I'm going to have to wrap up now. This has been fantastic. This is great. Yeah, I'm so glad. I didn't think we were going to do this, but I think it turned out great, and glad we connected, and let's continue the conversation. Okay, folks, thank you for joining us. I hope you've learned a lot from Pam. As we've said over and over again, dementia is sweeping the world. We got to be prepared for it. We got to know what it takes to strengthen our brains, keep our brains healthy, not just when we're young, but as we grow older as well. And also, probably just as important, we need to be able to know how to take care of our loved ones in the best, most supportive way possible. So these are all things that are very important. I hope you took down Pam's website address. It is Ageducate, AGEUCATE.com, right? Ageducate. AGEUCATE.com. Perfect. Ageducate. So make sure you go to our website and check things out. All right, till next week, we'll see you. Stay strong, stay safe. God bless. Bye.